To the Revita Health and Wellness Show. I'm your host, Francine Marie, and Dr. Peter Fotinos is always here to help us understand our hormones just a little bit better. So we're going to be talking about PCOS,
Yes.
the resistance of insulin.
Yes, in women. It's actually, we call it PCOS, but it actually should be called insulin resistance in women. We're naming a disease after one of the possible side effects that can occur from the disease, which is cysts on your ovaries. But in fact, the actual cause of the disease is insulin resistance. It's the most common endocrinological disorder in women. A lot of people are saying, what about diabetes? Well, in order for you to have diabetes, you have to have insulin resistance, specifically the type 2 diabetes that we get as we get older, okay? But you don't have to have insulin resistance. You don't have to be diabetic to have insulin resistance. So it's more common for people to be insulin resistant than it is to be diabetic.
Got it.
Again, most common endocrinological disorder in women, okay? There's two types. There's a genetic version of it. I have a lot of young ladies, and they're 14 years old, 15 years old, 13, in that age group that come in and they have this disorder from the get-go. And then there's an acquired version, and typically it could be in women in their 50s and 40s right about when they're going through menopause. We call that syndrome W, but it's still under that same guise of PCOS or insulin resistance.
Do most doctors know what you know?
I would say most doctors don't know what I know specifically about this.
Okay.
They know it as PCOS, and all what they will do, they diagnose it by looking on an ultrasound to look and see if you have cyst on your ovaries.
Right.
Well, again, like I said, you can have this disorder, and it's actually a poor name for the disorder, without having cyst on your ovaries. In fact, you can just be insulin resistant and not have all the side effects that occur with it and still be insulin resistant.
Okay. How are you going to find out if we're insulin resistant? Let's just start with the 14-year-old.
Well, typically though, it's like a patient of mine or somebody that's found us on the internet, they'll come and talk to us. What they'll end up having is they're noticing that they're gaining weight, they're unable to lose the weight, they're having irregular periods. Obviously, in the first year of menses for most women, it's going to be irregular, but if it starts being irregular even 3 or 4 years after that, then that could be a sign that they may be having this disorder. They also will come in with acne that's really bad, or hair growth on their body, hair loss on their head. And you also get a family history of it being in the family. You know, yeah, my grandmother was overweight, she had hair on her, acne. You can have these, you may not have these. The biggest problem with this is the inability to lose weight. So typically that's what happened with a 14-year-old. If somebody comes in older, 50 years old, usually this is about they can't lose weight. They're gaining weight, but the problem is they can't lose weight. And then, they also notice in hair starting to grow in areas, acne, oily skin. They can also notice irregular periods as well at that time. It's very similar whether you get the acquired version or the genetic version.
And the Revita approach,